Dhavale, what you do?
My name's Dr. Megha Dhavale. I'm a GP based in North London. I've been teaching medical students women's health for over 15 years and recently started doing talks for the public, and women's health is my passion.
So what is the menopause?
So, the menopause is a natural process. Every single female will go through it at some stage in their lives, usually around the age of 45 to 55 years of age.
What are the stages of menopause?
So the first stage is the perimenopause, which typically starts in your 30s. At this time, your hormone levels are fluctuating and you may notice symptoms of the perimenopause. The menopause is defined as 1 year, so 12 months since your last period, and after that, you're postmenopausal until the day you die.
What are the symptoms of menopause?
There's lots of different symptoms. There's over 35 recognised symptoms, if not more. The commonest symptoms are your vasomotor symptoms, otherwise known as hot flushes and night sweats, but women may also be troubled by anxiety, insomnia, brain fog, palpitations. The list is endless.
What are the red flag symptoms? I.e., what is not normal?
So there are symptoms which necessitate a doctor's visit, and that's bleeding after sex or bleeding in between periods. Whilst this doesn't necessarily mean it's cancer, it's really important that we investigate this. Also, if you're struggling with your symptoms of the perimenopause, please don't suffer in silence. Speak to your GP. They can help you with this.
How can I keep myself happy and healthy during this time?
There's lots of things you can do. The first is to look at your lifestyle. So simple changes such as stopping smoking, reducing your alcohol content can really help, especially with things like hot flushes or insomnia. Also looking at exercise. So weight bearing exercise is really good. So walking is really good, or running if you prefer to do so. But also bone strengthening exercises such as yoga, Pilates, weights. Also looking at your diet, there's some evidence that phytoestrogens, so things like soya, are beneficial, especially for hot flushes.
What could be the impact of menopause at work?
So the impact on work can be immense. We've got to remember more women are working. The latest statistics show that over 4.4 million of women aged over 45 are working. Women are usually at the peak of their careers in this age bracket, and they may also be juggling family life, aging parents, their own medical issues. So it's really important that women are offered support. There was some research that showed that a third of women took sick leave because of the menopause but weren't able to tell their employers because they felt too embarrassed to talk about it. So it's really important that workplaces recognise that women will be going through the menopause. It will happen to every single female, and for them to have menopause policies in place or menopause support groups to try and help support women furthermore.
What could be the impact of menopause in a relationship?
So the impact can be negative for some. With the perimenopause, it can lead to vaginal dryness, which can lead to painful sex. This can cause issues with intimacy in a relationship. Women can feel quite depressed about this, and this can further divide a couple. So again, if you feel as though you're struggling, there is so much out there that you can do to help. But if you feel as though you're stuck, please see your GP.
What should women that are considering gynecological procedures consider before going through the surgeries?
So there's so many different types of procedures. So I think it's really important to know what procedure you're having and whether it will cause a surgical menopause. So any procedure where the ovaries or the womb are removed will cause a surgical menopause. So find out what your options are, what can be done to alleviate your symptoms, so that something can be put in place straight after surgery rather than suffering months down the line.
What could men men do to support women through menopause?
I think there's lots of men can do. I think firstly, listen rather than try to fix the problem. I think we all have a habit of wanting to fix things. So listen to your partner, provide them with support, look at resources from a trusted source such as the NHS website. Ask your partner if there's anything you can do to help, and it might be something as simple as going along with them to their GP appointments if they wish you to do so.
What advice could you offer to people who are in this stage of life, and where could they reach out to if they're struggling?
So the most important piece of advice is everyone will have a different journey. So your journey won't necessarily be the same as your mum's or your best friend's, but it doesn't mean to say your experiences aren't valid. If you are struggling, please do reach out for help. There is help available. Speak to your GP, but also speak to your friends and family. Share your journeys, find out what's helped and what hasn't helped.
What is one thing that you want everyone to know about navigating menopause?
I think it's really important to know that everyone will have their own journey. No two journeys are the same. Some may have minimal or mild symptoms, whilst others will have quite debilitating symptoms. So your experiences are valid, but also if you are struggling, please speak to your GP about this. And if you feel as though your GP is not listening or they're not hearing you, then find out if there's another GP that specialises in women's health that you can speak to.
How long can you be in perimenopause before you're in the menopause?
Right, so there is no set time frame, but the stage can last for many. Sorry, do I need to start that again?
How long can you be in perimenopause before you are in menopause?
So there is no set time frame. Everyone will have a different journey, but usually the perimenopause can last from anything from 2 to 8 years. Unfortunately, a third of women may suffer from perimenopausal symptoms.
Thank you. Right, so we'll move into true or false. So, true or false, menopause is not sudden.
True. The menopause or the perimenopause is a transition which can occur over a number of years. However, for some women, it may be sudden if they've had a surgical menopause, which is when the ovaries and or womb are removed, or a medical menopause such as chemotherapy.
True or false, perimenopause can start in your 30s.
True. So it's in your 30s when your hormone levels start to fluctuate and eventually decline, and it's around this time when you will start to notice symptoms. You may notice symptoms.
Do you want to do it again?
Yeah, sorry.
Okay. True or false, perimenopause can start in your 30s.
True. It's in your 30s that your hormone levels start to fluctuate, and for some women, they may start to notice symptoms.
True or false, most people experience symptoms.
True. Most women will experience symptoms, however, they will vary in severity and frequency. Some may have very mild symptoms and not be troubled by them at all, may just notice that their periods have changed, where others may have multiple symptoms and be severely affected by them.
Was I making too much?
No, that's fine.
Right, true or false, treatment is available.
True. There's lots of treatment available. I always recommend looking at your lifestyle first, just seeing what you can do yourself to make yourself healthier. If you're struggling, then please speak to your GP. There's lots that we can do to help.
True or false, menopause can be a sexual awakening.
True. For some women, they may be bothered by vaginal dryness, which can lead to painful, uncomfortable sex. However, for a proportion of women, they find this a liberating process because it marks the end of their reproductive stage and the end of periods. It's still important to remember to use contraception because pregnancies can still occur, but also more importantly, to think about using condoms because of the risks of sexually transmitted infections.
True or false? The body still produces hormones after the menopause.
True, the body still does produce hormones, but at a very reduced rate.
True or false? Women put on about £5 during the menopause.
Unfortunately, this is true. For some women, they may not put on any weight, but for the majority, they do notice a weight gain and a change in their body shape. If you feel as though you're experiencing this, it's really important to look at your lifestyle, look at your diet, try and incorporate some exercise.
True or false? Pregnancy is still possible around this time.
Absolutely true. So, unfortunately, pregnancies can still occur even though it marks the end of your reproductive stage. So, it's really important that you continue to use contraception, and your GP can advise you for how long this is necessary.
True or false? Most women will start the menopause around 51 years of age.
True. So 51 is the average age. However, it can occur anytime from the age of 45 up until 55, and for a proportion of women, even later than that. Anything below the age of 45 is abnormal, so please do speak to your GP.